A 36-year-old man undergo laparotomy and small bowel resection. That means which is a big operation. 12 hours post-operatively, he noted to have decreased urine output. Which hormone listed below is most likely to be responsible? So following small bowel surgery, there decreased urine output in the urine bag. So what will happen? Actually, what happens in the kidney tubule, the water is more reabsorbed. For this condition, there is a decreased urine. So we have to find out the chemical substances which is responsible for reabsorption of the fluid from the fluid, that means the water and sodium chloride and other chemical substances from the kidney tubule. Here the options are cortisol, ANP, that means the adrenal natriuretic hormone, vasopressin, insulin, and glucagon. So we have to find out one of the hormone which is responsible for this. So response to surgery, that means following any type of operation, different type of hormone activated and different chemical substances released, and the mechanism of action in our body changes. So first of all, the sympathetic nervous system is stimulated for this adrenaline and noradrenaline release from the adrenal medulla, and the blood goes to it bypasses skin and goes to the different visceral organ. Bronchodilation occurs, reduce intestinal motility, increase glucagon and glycogenolysis, and insulin reduce. First of all, let's see in emergency condition, what do you want to do? You want to do store your food materials. What is that? You want to get ready glucose, amino acid or fatty acid. It may be readily available in the blood. For this condition, which should be increased? Insulin should increase or reduce? Insulin should reduce to keep the glucose, amino acid and fatty acid in the blood. Glycogenolysis should be enhanced to make the more glucose. Glucagon hormone should release, because we know that the glucagon, it increases glucose. In emergency condition, we need more nutrition. For this condition, the food materials are increases in the blood, and it is done by different type of the hormone. Heart rate and myocardial contractility, it also increase. And in case of acute phase protein, different type of acute phase protein, they are released in response to surgery, such as the interleukin 1, interleukin 6, interleukin 2, and tumor necrosis cell factor alpha. Endocrine response also, different type of endocrine hormone release. One of them is vasopressin or ADAs, and it causes water and sodium reabsorption from the blood. So here we can see water and sodium chloride reabsorption from the blood. And vascular endothelial also, they are the nitric oxide release, which causes vasodilation. Platelet activating factor, it enhances cytokine response. Prostaglandin produces vasodilation. So these are the response of the surgery. So which of the following substances is responsible for this? Vasopressin. And in case of emergency condition, that means after a small bowel surgery or a big operation, the cortisol also released, but this function is different. Atrial natriuretic hormone usually not released. Insulin, it decreases. Glucagon increases.